Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She was the president of IMA in Udupi, and she did her MBBS from Kasturba Medical College and stood first to the university and got gold medal both in surgery as well as gynecology. And apart from that, she did her post-graduation from the prestigious Bangalore Medical College, where only the top meritorious people get the seat. And after that, she continued practicing. For past 25 years, she has practiced, and she has her own clinic called as Vatsalya. And along with her profession, she is also a good writer. She's been writing lots of columns to bring awareness among the public, and now she's coming out with her own book regarding the health of the women. So welcome, Dr. Rajlakshmi.
Namaste, ma'am. Thank you.
Yeah.
Thank you for the warm welcome.
Yeah. Tell us about your book. Why have you written? Is the health of the women different from the men? Why have you come out with the book only for the women and not? Because when I write about the heart, it is both for the men and the women. But you have written about the women. What is the reason?
Yes, ma'am. Nice question. Actually, even now I am also thinking about it. Why I wrote. Okay, first of all, because I am a women health consultant, that was one direction I chose. Second is, yes, there is some difference between the health of men and women because we women go through cyclical changes of hormones in a month. Because of that, there are many health problems. We are the ones, women are the ones who have menstrual cycle, who become pregnant, who give birth to a new life. So because of that, our health is different from men. And see, women are protected from some diseases till they are having periods. Their risk of getting some diseases is more once they attain menopause.
Especially the heart attacks are less until they attain the menopause. And after that, they become one with the men, almost quite parallel.
Same, both population, they are same. So
And
in that way, I felt.
And one more interesting thing is the women can do everything that men do. They can have all the diseases that the men have, but the only thing, the difference is men cannot do one thing, that is conceiving, becoming pregnant, and carrying the baby for 9 months and delivering and feeding the baby with the milk. And this is one thing the men cannot do. So in that way, I think the women are different from men in that regards. Yeah. And so you are right in thinking about the health of women. Yes.
And one more thing, what I thought is women usually neglect their health. See, if the child is sick, if somebody else in the home is sick, they run to the doctor. They keep theirs, we'll see tomorrow, day after, that is one. One more thing, madam, I thought, because there are too many sources of information about the health. So they get confused. To guide them to take the right direction to the health, I thought of writing this book.
So in that direction, I remember Anupama Niranjan. She wrote so many books for the health of the women, and almost 4,000 editions had come, and that is how her, writing was so popular in those days. Because at that time, the accessibility to the awareness or the knowledge was not there. We didn't have the Google Guru. Yeah, that's how her books were so popular.
As a child and as a student, I have read lot of her books. Maybe she was also an inspiration to write. And I like the point that she wrote about health, which were all like hush hush matter about periods and all. She wrote that time only. She gave awareness. So that was good in one sense.
And I'm happy that I have got Anupama Niranjan award also. Because
congratulations.
she's a role model for all the women doctors, and because she not only continued her profession, she started writing. So I think that writing is very important, because when you're treating hundreds of people coming to your clinic. But when you write, reaches the lakhs of people, and that's how it is important. Now tell me, what is this adolescence? Why that term adolescence has come from which term, and what are the problems of adolescence?
Okay. So, women's life, when we think, we have four stages: adolescence, the reproductive age, middle age, and menopause. So, this is the first part. It's same for boys and girls. So,
Hmm.
usually we used to say teenage from 11 to 19 years. But we have
Yes.
made it little broader now. From 10 to 24 years, they are called
Hmm.
as adolescents. We
Hmm.
always say hot-tempered people. They are bisi raktadavaru, we say in Kannada. Okay, why they are categorized is because they have different physical problems, different psychological problems, and they
Yeah.
might have learning difficulties also. But although they make 25% of our Indian population,
Hmm.
health wise they are little neglected. So
Yeah,
that is why
correct, correct,
that
correct.
group needs
No,
to
it
be
is like,
given more
taken
importance.
taken for granted. Their health is taken
Granted,
for granted. What will
granted.
happen to them? And then the mood
Yeah.
fluctuations are so much. They say ಹುಚ್ಚು ಕೋಡಿ ಅದು
Ah,
16ದ
huchu
ವಯಸ್ಸು
kodi
ಹುಚ್ಚು
manas.
ಕೋಡಿ ವಯಸ್ಸು ಮನಸ್ಸು
Kodi
ಅಂತ.
manas.
So they
Yeah.
are mentally also little disturbed and are not mature. So neither they are children nor they are adult. So in between, that is the problem. Yeah, please go
Trishanku,
ahead.
they are Trishanku sthiti. They are in Trishanku sthiti.
Yeah.
No, that
Okay.
happens because of the chemicals which have started increasing, fluctuating in them. Because of that, there are changes in their body. They gain height, they gain weight. There are changes in boys also, there are changes in girls also. The
Hmm.
changes in girls are very obvious because they start having their periods. The changes in boys also, you can see the mustache, they can have
The
their
voice
voice
comes
breaks,
and
the Adam apples becomes prominent. So all these
yes,
things are there, but women are given little more importance because it's an obvious change. Along with that, they start thinking, who am I? What am I? That identity starts it's here. They start
correct.
creating their own identity. And
Hmm.
even nowadays, the sexual orientation and sexuality that also starts gaining importance during this period.
Okay.
Mainly, one more point I would like to say is peer pressure.
Hmm.
They want to be one in the group. They don't want to be
Yeah.
left out. So they
Okay.
can drift into any problems.
Okay. Okay. So what exactly is this menarche and when does it occur? And what changes have occurred in the last few decades?
Okay. So menarche is the first period or the menstrual cycle, the bleeding what a girl gets.
Hmm.
This to get the menarche, that is the last stage. She has to go through many stages. And
Hmm.
these changes take over 2 to 2.5 years. She
Hmm.
starts with the growing in height, weight, shape changes, and
Hmm.
some fat accumulations takes place in the buttocks or in the breast so that she is
Hmm.
prepared for her future, whatever role she has to play. After that, she will have breast growth. Then there will be hair growth in the axilla and in the genital area. The last part will be the bleeding. Just
Hmm.
preceding that bleeding, she might have some white bleeding and lower abdominal pain. Also, to
Hmm.
tell that within some 3 or 4 months, she is going to mature and
Hmm.
she is going to get her periods.
Hmm.
So, these are the changes what is going to happen
So
in
I
a girl.
think at that time the mother has to keep a watch and then tell her, prepare her mind. And in case the mother is not able to do it, then she has to come to a person like you, and so that the counseling can be done to that girl. Otherwise, suddenly bleeding occurring, they may get really scared.
Ah, scared. They get scared and they come running to us. They think that they might have injured somewhere, they are hurt
Hmm.
somewhere, and somewhere
Hmm.
they're bleeding. So,
Hmm.
giving them the proper knowledge about their genital parts and what happens during those 28 days, why do they bleed, and if
Hmm.
bleeding happens, what they should do, all those
Hmm.
things to the mothers as well as the kid, the girl, we have to say. And
Hmm.
nowadays, even in schools, there are counselors because
Yes.
CBSE has made compulsory that counselors should be there, so they
Hmm.
also give counseling. They give this information to the girls, so they are well prepared.
Mhm.
Usually, they
There,
are
there
well
is
prepared.
there is some sort of myth, that many a times in order to increase the milk production, especially the Jersey cow, they inject the hormones, and as a result, the children drinking that they become obese and they become prematurely they become attain menarche. Is that true
Attain
or it's a myth?
puberty.
Yeah, yeah, puberty. Yeah.
Not completely myth, not
Hmm.
completely true. Also, I can say
True
there are
also. Yeah.
many many chemicals which play
Multifactorial,
in.
many
Many
factors.
factors are there. Usually, I said 10 to 14 years, but nowadays we see girls even in 7, 8, 9 years getting their periods. They start with the periods. Why this happens is because of some chemicals in our food. The
Hmm.
food habits, they are more into fast food, junk food, and the canned food, the soft drinks,
Hmm.
all food which is processed, made from
Hmm.
maida, chocolates,
Hmm.
ice creams,
Hmm.
and all that.
Hmm.
Along with that, their activity has come down. They are more into
Yeah.
studies. The exercise part is less. We use
Yes.
every day. There is use of plastic, the chemical
Yeah.
in the plastics, and even in the fruits and vegetables what we use, the insecticide used in that. And even the
Yes.
girls have started using cosmetics. The chemicals in the cosmetics also
Oh,
can
I
cause.
see.
Yeah,
Okay.
there is paraben which is there in the cosmetics, which is given for coloring, fragrance,
Hmm.
or the shiny part of the cosmetic that can cause
Okay.
problem.
Okay.
Okay. And more, I think even
And the
the
lipstick
usage of
also,
gadgets,
lipstick also,
gadgets,
okay, gadgets. Hmm.
gadgets. Yeah,
Hmm.
lipstick mainly, lipstick and nail polish, what they
Yeah.
usually use. And what happens here, I would like to clarify this also.
Hmm.
See, if it is usually branded one, we get the little higher quality one, we have to pay more.
Hmm.
Those ones will not have this BPA or
Hmm.
paraben will not be there. The cheaper versions which these kids get hands to,
Hmm.
that
Hmm.
has more, they feel that we can use it. That has more of this harmful
Hmm.
chemicals. So they need to be told that you shouldn't use that.
Hmm. Hmm.
That is why.
Okay. Okay.
So because of
And
all this, they are
how
getting,
the
and
plastic and the preservative in the this ready-made food, how do they affect the body?
plastic is absorbed as microplastics.
Hmm.
Okay, we carry our food. Children carry
Hmm.
their food in the
In
plastics,
the
and they are very
box.
good. They are fans of this Swiggy and Zomato. And Swiggy
Hmm.
and Zomato, the food is delivered in plastic and
Plastic.
hot food. Some more plastic gets into our body.
Yes.
Even
Yes.
sanitary parts, what we use, in that also
Hmm.
some plastic can get into our food. And their favorite Maggie. Maggie has sodium monoglutamate. That also alters the hormone milieu of our body. So because
Hmm.
of that, they attain early periods.
Hmm.
Last thing, but most important thing is the stress levels. It's a competitive
Okay.
world. The kids are
Yeah.
made study. You have to get so much of marks. So
Hmm.
because of the stress itself, the hormones start functioning, I think, and they get into the periods early.
Okay, okay,
Yes.
okay. I think the parent should be aware of all these things and keep the child away. So when they're 5, 6 only, they have to keep away from the junk food and all those things. Very good.
Yeah.
And now regarding the menarche, what are the things that the mother has to tell, or you people, as counseling people have to do? And what are the other problems during this adolescence? Apart from
Okay.
attaining the
So
menarche. Hmm.
okay. Usually we tell them the process, what happens. And mothers, you might have seen, as usually we see these days, they prepare
Hmm.
the girls, and always there will be one sanitary napkin in their bag. And they
Bag,
will
yeah, because they don't
bag
know when it is going to come.
when
Yeah.
they will get the periods. And we usually counsel them, if you see some bleeding from the private parts, you have to immediately inform. If you're at home, tell
Hmm.
your mother. If you're at in the school, please tell your teacher. They will guide
Teacher.
you what to do. That is one more thing to be told to them. And we should educate them to eat healthy during that time, because most of
Correct.
the kids don't eat healthy, and they tend to get severe stomach pain during that time, abdominal
Yeah.
pain. And because
Dysmenorrhea.
of that, they miss school also.
Yeah.
So we have to educate them to eat healthy. And one
Hmm.
more thing, pain means rest. That is what
Hmm.
our kids think. So,
Hmm.
but activity will make you
No,
relieve
no.
that
When you
pain.
are
Pain
saying
will come
pain
down.
means rest, it is not the kids. The government is thinking of giving 3-day holidays
Yeah,
to
they
the working women. So it's
no,
okay.
maybe
Yeah.
that is in the severe cases, ma'am. Like we can discuss, I
Dysmenorrhea.
think,
Yeah.
later. Because of endometriosis, women
Hmm.
are very badly.
Badly.
They are
Yeah. Yeah.
suffering. So in
Yeah.
that case, it may be okay. But I feel
Okay.
sometimes it is like notifying I'm having my period. So
Okay,
I don't.
okay. So thank you so much, Dr. Rajlakshmi. So beautifully, so nicely. You have explained. I'm sure many parents will get the awareness from your talk. Thank you very much.
Thank you, ma'am. Thank you for me having me here. Thank you. Thank you so much.